The conversation onward we go. Tennessee Republican Congresswoman Marsha Blackburn joins us right now. If you were to look at this, Marsha, through the eyes of the primary issue in this country, which is health care and health reform, particularly because Massachusetts has, similar to Tennessee, the state that you represent, a state mandate for health care with limited reform. So basically you get expanded coverage with limited market reforms. And in the case of Massachusetts, obviously taxes continue to rise. You've been critical in Tennessee as a result of, again, incremental cost with limited reform. How do you view Scott Brown's success in running against Coakley? Forget whether he wins or not. The mere fact that it's as competitive as it is suggests a shifting of the tide, in my opinion, in that state. How do you interpret it in the context of health care?
Well, you're spot on there. And indeed, the Democrats, as they brought in national Democrats in this race, they nationalized it. They made it about Obamacare. They made it about the national agenda that the president has in continuing that work. And I think Scott Brown was right to point out that the American people and the people of Massachusetts, and this is the seat of the people of Massachusetts, they don't want some of these programs that are being pushed in Washington, D.C. And indeed, in Tennessee, as in Massachusetts, they have been the test case for public option health care. In Tennessee, the program failed. It nearly bankrupted the state. We saw our costs escalate. Our Democrat governor has called the program a disaster. And we have also seen in Massachusetts where only 32% of your population says they think the program is working. And I think your costs have gone up about 20% for health care.
Yeah, again, I think any of us, and I could just show you the insurance stocks who are just delighted by this possibility. Any sort of any plan that expands costs without reforming the system, basically empowering monopolies or unreformed oligopolies to either acquire more customers or, in the case of no reform, to retain the status quo, is obviously good for them. I'm curious politically how you look at Scott Brown. And the reason I ask it is because Mr. Brown does not refer to himself as a Republican per se when he represents himself in his own material. That he has basically campaigned, as you just described, saying that this is the people's seat and he's running on an anti-establishment basis as a Republican, as opposed to advertising himself as a Republican running as a Republican, if that makes sense.
Absolutely, it makes sense. What he is saying, let's return back to conservative values. And what the people of Massachusetts, 53%, say that they're independent voters. And what they're looking at is how a person is going to vote. And you know, Dylan, as I'm around the country, there are fewer and fewer people who say, I'm a Democrat or I'm a Republican. We understand that that's the way Washington works with the two-party system, but we want to focus on what is going to be best for the country. And I think the people of Massachusetts are saying this is the people's seat. We want the spending to stop. We want to go back and focus on what is going to be good for freedom and keeping this nation free. And that is why they have backed away from the Coakley campaign and came back, revisited, looked at Scott Brown and why he is running as well and as powerfully as he is today. Yeah. I think it's going to be, it sends a message to Washington, and I think win, lose, or draw, whatever happens tonight, tomorrow the Democrats are going to be forced to bring this health care debate out into the open. And quite frankly, I think that's one of the things that they have been fearful of, is having a very open and honest debate about health care and making certain that, as you talk about reforming health care, and as you pointed out, when you expand access but don't go through the reforms, you are going to see that cost escalate. Yep. Let's recenter this debate and talk about what we do to get the costs down, to hold insurance companies accountable, and to increase access while we have the focus on affordable costs.
Understood. I agree with you, and I hope to see you soon.